report is your problem.
Medication.
Oh, we got
Sure.
you.
Management.
We found one, but it was too much for us. We didn't want to
ER, the hospital.
ride at the golf course.
We're all looking
We're
at
a little long business. He had to run
Well,
there
we weren't.
for a while,
Well, not
God.
but he wanted $250 a month for it. And
Is that
we
yours?
Is this
signed
thing-
it.
I don't know. Well, it might be because I
Take
I
out.
printed
printed
one
one
off.
off.
Want to split it? He's put a half a sign or something up there.
Yeah.
So
That'd work.
Actually,
if it comes in again, I'll talk to you about that.
Okay, do that.
Okay, it's 12:05, let's get started. Like to call this, meeting of the hospital board to order. We do have a quorum. First item of business is public comment. Do you have any? Do you have anything? Okay.
Well, you only showed up
I
at
know.
11, and so I think we got all of our questions answered between
Okay.
11 and 12. Hopefully.
Did we? Okay. Good.
We kind of caught her up to speed.
Okay. Okay, next we have approval of minutes from our last board meeting. Did everyone have a chance to review those?
I'd move they be approved as distributed.
Okay. Okay, thank you, Carol.
one little correction.
Go ahead.
Let me find it here. So on page 7 in the packet, proposed write-off of MRHC debt, about halfway down, MRHC is unwilling to partner due to the debt. It should be unable.
Unable? Okay.
Yeah. That's the only thing I had.
That's more accurate. Okay, any other comments? Okay. All in favor with the additional change?
Aye.
Aye.
Any opposed? Thank you. Okay, Mineral Community Hospital reports, med staff report. I don't think we have anyone here from the med staff.
No,
Is there anything?
they're all in the ER. I guess they got 4 ERs going right now. So could I have that time to talk about the kind of stuff
Add it
that
to the CEO report?
Yes.
All right, well, let's move
Quick
on.
time.
No.
No. All right, let's move on to CEO report.
Well, the reason I wanted a few minutes more was we had a survey yesterday, and I just wanted to talk about that a little bit. Oh, you brought your timer. Oh, geez, get strict about this. All right.
I think we're all meeting fatigued. I think we need to not rehash a lot of the same stuff.
Right, I agree. Well, the medical records survey, we had a surveyor from the state show up yesterday. Day before yesterday, she was here the day before from about noon till yesterday about noon. She came back. She's from Missoula. She works for DPHHS.
What's that?
The Department of Public Health and Human Services in Helena. They do this, all the surveys, I mean, for hospitals, long-term care, nursing homes, assisted living, but they're really Medicare and Medicaid surveys, from the federal level. And the upshot of it was, I'll just cut to the chase, there were some issues, it was just focused on medical records, which was a good thing, because if she'd done a full-blown hospital survey, I'm sure we would have more issues to deal with. But she found a couple of things out of compliance with the medical records in relationship to the follow-up with incomplete medical records. We weren't following our medical staff bylaws, and just some other stuff she was concerned about. She'll go back to, she's from Missoula. We'll go back there, write the report. She has 10 calendar days to write the report. Then we have, now it's the other way around, 10 working days she has to write the report and get it to us. Then we have 10 calendar days to submit a plan of correction. In the past, how should I say this politely, the previous CEO was very unwilling to work with Kirsten to run those plans of correction back through the quality program, the quality process, performance improvement process. And it's a flat-out requirement that you do that, you know. So we won't have that issue this time.
Is
and
this
I
a
will.
hangover from prior,
No,
or is this?
no, it's a current issue. Well, yes and no. The same conditions of participation that she put out of compliance were cited in the 2011 hospital survey. So it's the second time around, and that might make it more serious, you know, in terms of how they approach this. The key thing is that we need to get on it right away, and we will, certainly we will. Verna, myself, Julie, and Kirsten, to fix the issues that they call forth in the report. And I'll just leave it at that. You know, but I need to let you know that that's in process. And there is risk in terms of the Medicare and Medicaid payments. If it depends on the attitude that the surveyors take, but usually they're pretty good. If you write a really good plan of correction and you follow up with that plan of correction and implement it and continue to follow it, you know, for a period of time, a year to 6 months to a year, and make sure that it stays fixed.
Was there a plan
Then there
of
won't be
correction from the prior?
Yeah.
I don't remember, but it just wasn't followed through with.
Well, it wasn't done correctly,
Okay.
and it wasn't followed up. And so here we go a second time with the same conditions of participation out. And one of those is the oversight of both the medical staff and the board of directors to make sure that it is followed up in terms of the quality and performance improvement. So, I mean, it was cited at that level this time, it was cited at that level last time, and just to let you know that that's coming down the pipe.
How did you do that?
Well, we'll have to build that into the plan of correction, that we report to you, that this is being monitored and fixed, you know, through the quality process.
Did we have a change in medical records personnel during that interim time at all? So same person wasn't able to follow through?
No, I don't think so. I mean, Verna has been here a very long time, and Julie is.
Yeah, it wasn't her name.
Yeah,
It was not?
yeah, no, it's more relates to the medical staff bylaws, you know, just some process stuff that needs to be fixed, so.
Was it a matter of it, last time around in terms of board follow-up, was it a matter of it, the board was never informed? That
Yeah, exactly, exactly. It just wasn't reported up to the board like it should have been.
I don't remember that at all.
Yeah, it was not. It was not.
It wasn't reported at the quality improvement committees that I've attended.
Right, that's correct, and because of, you know, past history, there was a lot of resistance to do that, you know, and bring those things forth. I guess that's what I'm saying. You know, that won't be the case here, you know, we're very transparent, and you just need to be aware of that.
Right, yeah, well, you're doing exactly what should have happened a while back.
So that's all I have on my first 10 minutes. How much?
And just, that wasn't even 10 minutes. Just let us know, as far as the action plan, what we need to do in
Yes.
helping that action plan.
Yes, we will certainly share the plan of correction with you.
Thank you.
As, you know, we've got about 20 days here probably before we, roughly, before we have to, or maybe a little more with the work days, you know, half of them are work days and half of them are calendar days. So by the next board meeting, we'll have the plan of correction for you, and we can show you what what the board needs to do and what management needs to do to make sure we follow up with this and follow through with it, so it doesn't have any further consequences. CEO report, you're okay with that? Mm-hmm. All right, the other things on my list, you know, the board last time approved a halftime patient satisfaction customer service specialist position. Bill reports to me that the health center has approved a similar position, not exactly the same title, but a similar position on the health center side. We were waiting for that, to follow through on our side. The board last month gave me the go-ahead to advertise that position, and we will do that. I'm almost done with the job description. I was kind of waiting for, a few things here with Bill. We will share the benefits.
I was gonna say, are you gonna be coordinating, is it a single person that's gonna do both?
Well, we're opening it up for
We
applications.
kind of like to do that if possible.
Yeah.
Coordinate to be the same person working half-time for us and half-time for,
Right,
Okay.
for the,
right. That would be our goal, is to, and that provides some continuity on both sides of the house too, so.
we think since we're trying to do a lot of joint promotion between both of us for providing combined health care for Mineral County, that it would be good to have this same person in one person in the same position for both of us.
Exactly.
Yeah.
Bill and I and, the leadership team, we've been talking about that with the health center for some time. On our side, we feel, for example, a good example is patient satisfaction surveys. If we have the same person doing that on both sides of the house, making those phone calls, those follow-up phone calls to patients, which are very well received, it really helps retain our business, build our business, build our visits, and you have duplication. That patient on the clinic side will come in to see the physician or the mid-level, and then come over here and have lab work or imaging work.
Well, continuity of care.
Yeah, exactly.
Yeah.
And if there's a problem somewhere in the process or in the chain there, it's very nice to have the same person making those phone calls, and coordinating the issues back and forth between the two. And it's really, as we explained, as we talked last month, it's really worthwhile, I think, to have that person. It's very beneficial. I think it helps us. The dollar spent on this position on both sides comes back to us, I think, many times over in terms of increased volumes, hopefully. But I think it does. The sale of the Traveler House, the Mueller House, where we are with that, we're gearing up, for the yard sale. We have a lot of things down at the Mueller House that need to go in the yard sale. 4-drawer file cabinets, tables, a couple of tool chests, that they used to use for med boxes, med carts. I would think some of the handyman folks would be interested in those kinds of things. We don't have any use for them. We need to get them out of there before we sell the Mueller House. We also have a lot of medical records in there that we're trying to get out of there and sort through them. But anyway, there's a lot of stuff to be done.
Do you guys need help getting that house cleaned out?
The house itself, we've had a lot of questions from our employees the last few days. We're going to leave the furniture, the appliances. George Spangler recommended we do that. The house shows better, if it has those things in there. No, I think we're okay. We've got a crew coming at, 10 o'clock on Friday. The foundation board is handling and sponsoring the yard sale. If you want to show up at 10 on Friday, anybody's welcome to do that. We could use the help. That's certainly true. But the plan is, we have not signed the listing document because the time clock starts running on the listing document. We felt that you gave us authority to do that last time, but we have not done that yet. We want to get the thing ready to go and ready to show, and then we'll list it and go from there. George did indicate, by word of mouth, he has had one party that's been interested in it because of the shop, because of the extra building and stuff. I haven't heard from him the last week or so I'm not sure, how that's going. We talked about the yard sale. Anyone that has items that they might wanna donate. We've accepted a lot of things up here. Please bring them up or give us a call. The biomass grant, I talked to the executive committee about this a couple of weeks ago, but the hospital did have a $190,000 Forest Service biomass grant that was awarded, I believe, a couple of years ago when you were working on a new hospital. Forest Service folks called Cliff and myself, and we started working with them on, they did not realize that the hospital was not proceeding with the new hospital. This grant is very limited to planning and engineering. It cannot be used to buy pellets or equipment, anything like that. It's just planning and engineering. They were gonna, take the money back, and we talked about that for a little while. And I explained, or I got some information to them that there are 4 places on the campus here that are not tied into the pellet boiler. The clinic building here is heated with propane, actually. The lab extension area over the lab, that new area with mammography, is heated by propane. The PT area, which was added on at one time, is heated by propane. And the assisted living unit, which is separate totally, most of you know that. All of those areas are heated by propane, and it's expensive, as Stacy has told me. We still get these big propane bills, a lot less than we used to, Certainly the biomass pellet boiler is very cost efficient. We've saved a lot of money in comparison with what the bills used to be. But this, I convinced the Forest Service people to, I sent them a letter, asked for an extension on the grant. It was going to expire the 30th of September of this year for 2 years, so it'll be 2016, I guess, of 9/30, September 30th. And we'll look at getting a proposal or an engineering plan, and
To maybe add those other areas.
Yeah, to add those other areas.
Larry, who are you working with the Forest Service?
Oh, what's her name?
Julie Keys?
Well, Julie Keys is the state lady.
Yeah, Angela.
Farrar, I think, or
Farr.
Farr.
Oh,
Angela Farr.
Okay.
Right.
Yeah.
I think she's been the biomass coordinator for quite a while.
Yeah.
Julie Keys from the state also came out and is working with us, a couple months ago now, Cliff, right? And met with us, and Sherry and the maintenance crew, to talk about being more efficient and doing things a little differently with the pellets and working with us with that. She's been very helpful with that part too.
One thing, if in the planning process as you go forward, if they can explore, and if the Forest Service grant will allow this, and it may not, because it's not going the direction they focus, but explore some combination that also uses ground source heat pump, which is a really cost-effective heating system. So
one of my old facilities way back, White Sulphur Springs, uses. They have for many years.
Yeah,
Who's putting the parameters around the planning grant?
Well, it can all be used for engineering and planning. The main thing that we talked about though was there might be some way to do the cost benefit analysis that shows that the thing, if we can figure out something if it's more cost effective, maybe we can figure out, we need those numbers to show. If it's more cost effective, you might be able to go out and just somehow find the cash to put in the equipment that needs to extend out there and pay for it over a period of years or something,
I would mention that, I mentioned last time, but the pellets that we're getting are not good.
We know that.
And they've not been good for 10 years. And I would think maybe we ought to look at the feasibility of using chips versus pellets.
Yeah, we could, and the commissioners talked about that, you know, when I met with them, we visited about that. I don't, you know, maybe you have to change
Yeah, that's what I'm saying.
the firebox or the boiler or something.
Could you work that into the grant, see the feasibility of it?
Yeah, we could, we could.
You know, I don't know if this would be parallel with what is going on with this grant that we already have, or if it would be, if you could tie it in, but we're starting like a working group in the community that's like made up of the McCrag group and some others in the community and the Forest Service, and we're looking at a grant right now that is very similar, I think, to the one that that the hospital got, and it has to do with potentially making somebody in the community, whether it's Tricon or one of the other entities locally, able to make a product that's a better quality product for not just the hospital, but potentially for the school when they get there, and anybody else that would come on board. And so it's very beginning just talk right now, but there is a lot of interest in that. Could we get a grant to build this structure, whatever they need, infrastructure in place to be able to produce a quality product right here?
TPM, I mean, to produce the product. Would it be chips or pellets?
It would be whatever was needed, I think, for the hope. I think there would be a hope that the hospital, the school, and whoever else got on board all use the same thing.
Yeah.
So that they could
Right.
make it easy. But
Back to the question with Jim, though, I mean, we're very aware that the pellets here, it's caused us a lot of issues, and certainly Plains, the hospital in Plains, Clark Fork Valley Hospital also has a pellet boiler, and they shifted away from this pellet supplier here locally, what, a year and a half ago, Sherry has talked to them, Sherry Spangler has talked to them about that, and we have not done that because we had a previous grant that paid for the pellets for supposedly 2 years, but it's been, I think, longer than that, or close to that.
About 2 years.
We've never paid for any pellets, and the folks at maintenance keep telling me there's gonna be another load. We just have one more load coming, and, you know, then a couple months later, you know, oh, we got another load coming, you know, so they haven't run out the $20,000 for the pellets yet, but when they do expect that will happen though next fall. I kind of pinned them down, and at that point we definitely will bid the pellets. You know, we will bid the pellets.
right, and I know that the quality. We talked about it just briefly, and I have a very limited understanding of the issues,
Yeah,
but
me too.
from what I understand from Ken Burley from Tricon, is that you know, some broilers can handle just about any kind of thing you throw at it, whether it has mixes of dirt and everything else in it.
Well, that's what we're getting now.
And then others can't, and I guess they're trying to go to a much cleaner product that you're not gonna get, you know, grime and build up and cause rust and other issues, so that's kind of what they're looking
Aren't
at.
there any federal regulations about the quality of pellets after 10 years? That's crazy.
Well, I think part of it is, Carol, that they produce what's called a clinker in the system. And then you have to shut the system down to clean those out. And so the cleaner it is, and the less clinkers that you end up, now this is layman dangerous talk, the less times you have to shut the system down to clean the clinkers out, the more you can be
More
producing
efficient, yeah.
energy and all those sorts of things. So that was what we experienced at Plains, we were having to shut the system down so often to clean out.
That's exactly what's happening here.
The clinkers in the system.
The guys tell me that during this last winter, they were spending 2 to 3 hours every day with these clinkers and the ash and stuff. And they thought that and we get our pellets in big bags, you know, and they have to forklift them up into that bin out there, and then they gravity feed down to the boiler and stuff. And they thought they were getting better a couple of loads ago with with the pellets, but then they got to the bottom of these bags and they realized that they're dirty again. They're getting a lot of dirt stuff in them, so. We're working on it. You know, it's good discussion, I'll appreciate it. Surgery continues to roll along. Both the surgeons were on vacation this week. We're not doing anything this week, but they've been doing 4 to 5 procedures, scopes and surgeries every week, and that's been pretty good business. It's helped us, hopefully financially, although we're paying quite a bit for CRNA services, and when I find some time, I am going to sit down again with the CRNA and actually, you know, get that rate. We've got to get the rate with the CRNA down. We do not get reimbursed. Deb and I talked to our CRNA that we have. He's excellent, gives excellent service, and we certainly want to retain him. I think he's an important component with what we do with surgery. We've got to have him, but he's kind of expensive. So we're working on that issue.
Sorry, what is a CRNA?
Oh, I'm sorry.
He does the
My lingo again.
anesthesia during.
Yeah, anesthesia.
Oh.
It's a certified, registered nurse anesthesia.
Anesthesiologist.
Right, right. A nurse who is a gas passer.
Yeah.
Yeah. Yeah, I should use the term gas passer. I've done that before too. Lab restructuring, we kind of talked about that yesterday, I think, a little bit, didn't we, at the retreat, but we did it medical staff the other night. We had medical staff this week, and Tom is working through the decisions that the board made last month to restructure some lab, the lab in terms of blood banking and
Microbiology.
yeah, microbiology, both. That won't happen instantly. It's phasing into, he's been very careful about phasing into it with the medical staff, and has been talking to the medical staff and doing that. But we will eventually see about a $40,000 to $50,000 savings there because of some of those things that we're doing a little differently with those two areas. Maintenance has been kind of nuts as it always is. We had 3 pumps, 3 pumps on the air conditioning system that are not working. They all have to be overhauled. They all have to be removed from the roof. I didn't even know it, but they have some sort of a lift thing that they actually keep it up there, a winch or something that puts them over the edge, and they're heavy, and then they lower them to the ground and haul them into Missoula to have them rebuilt. Each one of them's $1,200. They're starting to have
Is
a
that
lot
all,
of.
is that all we have, or are we gonna be left without any air conditioning in the hospital?
Well, I haven't noticed any lately, so it's the time of year where,
I'm just thinking about the patients and it getting
Right.
unbearably hot.
right.
And the staff.
Yeah, right. It has been warm this last week. The weather has certainly gotten warm. It's operating, but as they take these pumps out of service and get them in to be rebuilt in Missoula, there may be a section of the hospital. There's 3 of them, so they're taking them out one at a time and taking them in and fixing them and bringing them back. So, it's just been a process. Also, there's some problems with the controls. There's a number of controls, I think more than 3, that Mike said that they've had to order those, a couple of them lately, and they're $250 or $225, $250 a piece, to get them, and it takes them a little while. Just to let you know that there are issues, but it's not. It's not going to shut down the air conditioning for the whole summer or anything like that. The lawns have been an issue. The lawnmower is not working correctly. It's really, although they overhauled it lately, and hopefully it's a little bit better. It's hard for them to keep up with that this year. We have plugged a few CNAs, nursing assistants, into the process to help out with the lawns. And also, Sherry's been talking about, and it's proceeding to contract with somebody. There's a lot of lawn around here, and we have been talking with a local person to do the lawns in the front of the hospital and on the side by the clinic. The maintenance crew would continue to do the back lawn.
Larry, who's taking care of the St. Regis Clinic lawn?
It's nobody.
Yeah, it's really,
Yeah, Deb reported that too. She drives by there, a couple times every
Do I
day.
need to get my lawnmower over there?
Would it be appropriate if we, we had a high school young lady that, I don't know if she's interested, but, that helped out with the maintenance back there.
I guess are we okay insurance-wise doing that?
I think they have to be of a certain age to be on lawnmowers.
Well, she was working for us before. Oh,
Yeah,
on
but
a
she
lawn.
wants to do it, you have to be on the lawnmower, it has to be an age.
We'll address it. We certainly will. We don't want, I think I reported, maybe I didn't, to the board, but Sharon Patterson contacted me about a month ago.
For
Did
the
I
plants,
talk
to
about
get
it?
those-
For the plants and
Yeah.
stuff. I don't know that she ever got those 4-H kids to take those plants back over.
Yeah, and actually, as I was reading through the minutes last night and saw that issue, I was thinking, I wonder if we ran that by Mr. Lincoln before you see somebody digging the shrubbery out all of a sudden without, maybe we better do that.
Yeah, probably.
Kinda,
I didn't even think about that.
yeah, I didn't either
You're
until
right.
I was reading the package last night in the minutes, I went,
Yeah.
ooh, wait a minute. But if it doesn't work.
It's his ground and our building,
Yeah,
that's correct.
well, and again, he's been a little uncomfortable, we were a little lax on talking to him before, so we were
Right.
trying, we
Make sure
promised him
keep
we
him in
would
the
talk
loop,
to him, we
yeah.
should fix that.
Yeah, I'll follow.
But-
Well, and we'll follow up with the maintenance on that also.
Yeah. And if we're looking at a contract for somebody for here,
Maybe we
if
can
it
have them
doesn't
do it.
look like it's gonna work for the high school person in St. Regis, we can explore contracting it. That may be the most cost effective.
Yeah.
Yeah.
The guy with a business who's got the equipment anyway and
Right.
spreading the costs around.
Well, the deciding factor on the letting them do this up here is really that lawnmower needs replacing, and it's not really a lawnmower, isn't it a tractor or something?
Is it a
We're just
ride?
having all kinds of issues with it,
Tractor with attachment.
and we don't have the $3,000 that, to replace that right now. So $125 a week is probably the appropriate investment,
Yeah, it makes a lot of sense, and it's probably cheaper long-term than if we don't need that equipment for a bunch of other stuff that nobody else can do for us.
if you're looking at the contract, you might talk to the keeper of the banks, cause the guy that does the bank here also does it in St. Regis.
Oh, does he? Okay.
Is it a guy out of Plains?
No, there's,
Because
he's
I
all
know there's
kinda
someone
across from
from-
me, Green
okay.
something.
Yeah.
I think that's who she talked.
Probably is, that
Is
is,
that who it was?
Yeah.
Sure.
All
You
his
might check
equipment's
with
on
Ryan
trailer.
Morrison too.
With who?
Ryan Morrison, he does ours.
okay, is he the guy from out of Riverbend? or-
No, he's out of the Green Hunt, Quonset hut out there at Riverbend.
Yeah, okay,
Yeah,
that's who I mean,
yeah,
yeah,
yeah.
that's exactly who I mean, yeah.
Okay, we'll certainly follow up. Thanks for
I didn't know the name, so thank you.
The only other thing is the town hall meetings. I don't think the board had met last month when I talked about that. I characterized that with some of you as just the decibel level is quite a bit lower than it was 6 months ago when we started that with Cindy Sturgar.
Yeah.
We had a lot of folks come up to us a month ago after the 4 town hall meetings. In every location, we had people come up and say, we really appreciate you being here for the 3rd time in 6 months. You're listening, we appreciate that, and we appreciate the hospital and the clinic. Bill was on a number of those. Kim, attended one of them, I think. No, a couple of them. She attended in Alberton and at Kelly's Coffee Club, which was,
Yep.
that was a fun group. But the groups were much more, they asked questions, they had, it was a good interchange, and, I think that was we got a lot of questions, but we didn't have the high level of emotion that we had, about a lot of the history, 6 months ago, so. I think it's,
A lot more positive comments instead of negative comments.
yeah, I mean, we certainly had a number of concerned folks at all of them, but I would just leave it at that, I guess.
Okay.
That's enough.
Yeah, thank you, Larry. We went about 10-15 minutes over. Better than we have done. I don't expect the next gen report to take.
5 minutes, give me 5 minutes.
All right, I think I can do it.
3? Okay. 3
Well-
to 5. Okay. Next gen, we continue on. I think we are addressing most of the issues. We still have, some things that are obvious that we're working through, but I think all in all, things are starting to calm down. People are getting more used to the software and working through things. There will be continuing things. I don't care how long you have a software company, and there's always gonna be more to add. We have hopefully addressed a couple of the physician issues in the last little bit that have resolved some things from them. We've also dedicated Ray to the next gen product. So he will be our responsible party from the clinical side to make sure that things are moving through, that things are built, that the providers are seeing and getting what they need. Tonight will continue to help Ray and get that going. They will be working next week on a handwritten manual for the clinical side as to what the issues have been, what the fixes are, so that people can go back through those and know where to go with things. So I think overall, I think things are starting to settle a little bit more. From the billing office side, we are still going through every account. We are making sure that every charge is in the system, that they're not duplicate charges. As we get closer to May, we're seeing great things. We're seeing more charges being put in the system. We're seeing that the documentation is there, which makes us feel like we're getting more comfortable with the system. So we do have an opportunity next week where NextGen has offered to send the financial person out. They feel like we're at that point where we really have an opportunity to work with them directly. When they were here before, we were doing all of this sort of, this is what's gonna happen, now it's really happening, so they're going to do that. We're not gonna pay her travel expenses, so they're pitching in and gonna help us with some of those expenses. So she will be here Tuesday, Wednesday, Thursday of next week. We have not been able to close the month for Cliff to be able to do financials, and part of that is just us having to go through the system and make sure that all the charges are in there and
That's for
make sure that
March, correct? For March, we're gonna be able
for
to
March,
close-
yeah,
close
since
March.
we have close March or April, so.
How close?
We're very close to March, getting that done. We're about halfway through April. We are coding claims. Verna has a lot of claims that we've released to her in the last couple weeks that she can code, and then we can work on getting those all out the door. So I think it's going along. We're about 60 days into it. We had a call with NextGen on Tuesday to transition from the staff, the install staff, to the support staff, and so we're aware of who those support staff are going to be with us. We have contacts, and we'll get all of that out to staff as we merge into that piece in the process. We had a barbecue and banana split party for all of our employees on Tuesday. Larry and Tanai, I think, cooked hamburgers and hot dogs, and I was gonna get to that. They were assigned to cook, and Stacy ended up cooking, so, and she was very happy about it too. Anyway, so what I've heard from the employees is they appreciated it, they had a good time. We had banana splits, and we had a lot of joking and a lot of fun, and I think the employees really enjoyed their time, and
We cooked a lot of hamburgers, cause after the cookout, I went back in, I started to work on some of the paperwork, and I couldn't see anything and my glasses were full of grease. So I had to go wash my hamburgers.
What the lean
Go
cut.
wash my glasses, I mean.
Yeah. It was a nice day, you know, the sun came out for us, so all was good there. The other thing that we're doing in the business office is I have really two new hires. Amanda, who came from the lab, she was our phlebotomist. She is in the outpatient registration area, which is our new area.
That was 5 minutes.
Okay, I'll go quick. It's our new area. We're getting people transitioned over to that new area. We're seeing more people check in there, and it keeps people out of that ER surgery hallway. And I have a new lady that is starting today. Her name is Penny, and I'm not gonna have her last name. Anyway, she started today, and she will be my temporary for Clarissa's maternity leave, which could be starting just about any day. So anyway, both of these people, you know, the one thing that I'm really looking for is the customer service and the ability to speak to patients and to make them feel comfortable and to make sure that we're meeting their needs. And I think both of these people are really doing that at this point. So, number one goal, and then they'll have to train and work on all of those other things as we get them into the system. But I'm very excited about both of our new hires.
Do you have a feel regarding billing efficiency and the catch of missing pieces of information that could have resulted in a bill? Will this improve our efficiency overall with NextGen, or do you have a feel for the difference?
I think it will. I think part of what we were doing before in a totally paper system is we were entering all the charges. So we were looking at what happened in the emergency room and capturing all those. Now what will happen is, as they use things, they'll be putting things in or putting orders in that capture charges. So, you know, it's kind of you could be missing this stuff in a paper world, but in an electronic world, it's gonna do that for you, and you might miss something else, and that's really why we're spending so much time going through every claim. And if there's an issue with something, we're not just putting the charge in the system, but we're also going back and saying, how come this did not happen? And how do we make sure that this happens? So we're trying to take a little more time up front to make sure that the system is built and not just, we'll deal with that later when we get everything else done.
Great.
So, you know, a system in my mind is only as good as the build that you put into it. And if we could do a good job of that, then that'll help us down the road. So, Laurel, do you have anything to, I waited till you took a bite.
I mean, it does seem like it just gets easier, you know.
We're going.
We're going, yeah,
It does get easier.
I think.
There are certain days there are frustrations.
Yeah, but I mean, it's, I don't know, it's just what it,
Well, it's anything new.
exactly,
Yeah.
it is, it's anything new, and it's okay. I mean, I think that the product is maybe not perfect, but it's fine. I mean, it really truly is fine, and it's getting used to flows, and, you know, and it's new, like you said, it's a change, it's different.
Yeah,
I don't really have anything really bad to say, you know,
Yeah.
like I don't, it's.
Yeah, I mean, the practitioners in the ER are having to do a different step that they didn't used to have to
Yeah,
do.
and we
So
haven't
that is
converted-
gonna take some.
Right, we haven't converted an ER yet for providers,
Okay.
but the floor, you know, but I mean, it's just different, so you
Right.
instead of writing your orders, you put them in the computer, you know, I mean,
Yeah.
it's kinda,
Okay.
it's just different, it's not.
And the clinical staff has really had an uphill climb because, you know,
Oh, definitely.
from the business office and registration side, we've worked on computers, but you know, our clinical staff has been a totally paper system.
Mhm.
Yeah.
And to go from total paper to total computer is really a tough step to get through. And they've done a phenomenal job. And I think we're getting
Well,
there.
you frequently, when that kind of transition happens, run into a level of resistance, and it doesn't sound like we're getting that here, which is good, and it's a compliment to the clinical staff, so I think that's a good thing.
Laurel, as the eternal optimist, I've decided.
Yeah, and we've done it in the clinic too, so
Yeah.
that, I mean,
So,
we're the same.
Just one quick comment about next gen. Deb mentioned it, but Ray, she talked about Ray, and that's Ray Fredette, who is an RN, he lives in Alberton, and we have freed up some time for him to really, about half of his time, to work on the coordination with the medical staff and nursing. I mean, we felt that it was very important to free up a clinical person who can talk the language. Julie and Deb are not clinical.
We're dangerous.
Yeah, and so it's just very important, it's just very important that we have someone that talks the language and the clinical language to help the medical staff and to help the nursing staff.
And from I do
You know,
think that's
slide into this, and Ray is very good, he's young, he's used to electronic systems, and,
I think it's a
he's
great.
about as young as Laura.
It's probably bigger. It's a good, I think that is something different than implementing in the clinic, was that, you know, when we did the clinic, we had meetings on the clinical side just once a week, half-hour meetings where we said, anybody not know how to do something, we would show them, they would show up, you know, we would do like a little, this is a trick I learned, does anybody have questions, we would ticket them, get back the next week. Well, with us, there's only one provider working, and often we don't talk to everyone, you know, depending on who you shift to, there's only one nurse, and so that part has been a little bit trickier, where you learn little quirks, or you learn something that's a little bit harder to communicate, and I think having Ray in that piece will just help everybody get up to the right speed on it, you know, because I think it's good to have a tie everything together kind of person,
Good.
so I think that's a great addition.
thank you.
Good idea.
Okay, let's go on to our other reports. Foundation board meeting. Is there anything quickly to report, Nancy?
Just the yard sale.
The yard sale on the 7th?
Yeah.
Okay. Board committee reports. I didn't have finance committee on here. Was there a finance committee
No.
today? I didn't think there were finances. Okay. That weren't ready yet. Jim, bylaws?
Can I have 5 minutes?
You can have 5 minutes. I didn't know if there was anything or
I
not.
just wanna take, then I've got 5 minutes for sale, if anybody wants it.
We didn't use the full 15 minutes that was allotted for next gen, so.
Larry already bought it.
I think,
Oh, okay.
oh, Larry already used that up,
Larry
so
owned
go
it.
for it. Go ahead, Jim.
I don't have any.
Oh, you don't have it? Very good. Gary?
I'm pretty much the same way.
Clinical outcomes.
There's two committees, that I attend. One is the Quality Improvement Committee, and, I reported to the board at the last meeting, so that the Quality Improvement Committee hasn't met since then. The Clinical Outcomes Committee will meet a week from today, so I don't have a report on it either.
Okay. Carol, Customer Satisfaction Committee, you guys haven't met yet?
If they have, they
They have,
don't
they have.
know. I don't think they've met, I think Tanae is just too involved with
Next gen
and
right
stuff,
now.
so, no, we haven't met.
Okay, Professional Affairs Committee, I do have something. We do have a med staff appointment. It is for one of our radiology group, for David Berman. So, I have met with Julie about this, so that is the recommendation of the medical staff as well, that we appoint him, or give him privileges.
Okay, we've been through and done all the required checks.
Yes,
know-
the medical staff did.
Yeah.
Okay. Where's he located?
Where does he live
Yeah.
currently?
I think Idaho Falls is.
Yeah,
He's
they're-
part
they're
of the
almost all in
Idaho
Idaho.
Falls Imaging Group,
Yeah.
so it's the imaging group that we go through.
Yeah,
He's young, right out of residency.
I mean, no one will ever see him. I mean, it's all done by,
Wow,
electronic
there's quite a few.
systems.
There's quite a few of them. So,
I'll move approval,
you would just wanna say,
approval of David A. Berman, MD, for, do we have, for the
for
year
courtesy
20
status.
Courtesy status 2014 to, it's not filled in yet.
No, the 2 years.
2 years?
Yeah.
Okay, 2014 to 2016. I'll make that motion.
Okay,
Second.
thank you, Jim. All in favor?
Aye.
Are there any opposed? Okay, very good. And that's what we have for that. Unfinished business. We have hospital board appointments, recommendations. So, first, Jim, were you able to get, I did speak with the county commissioners and they did, approve a resolution to appoint Jim and Virginia to those trustee positions that were not filed for. We still had the 2-year unexpired term, which we still don't have anyone for yet. But Virginia, last week, sent me an email and said, and I've talked to her yesterday as well. No, day before yesterday. She did not apparently want to be appointed to that position. And so we now have 2. I think I sent everyone the email, I'll just read that. She said it was to the MCH board, it was a privilege and an insightful experience to be on the board for a few short months. I was pleased to meet such hardworking and dedicated board members whom I would not have known otherwise, and to have a glimpse into the other side of a hospital. It is an honor to be asked to continue to serve, however I have to decline that offer. Please know that I support your efforts to get the hospital out of its financial constraints and to change and improve the hospital image in the community. And signed, Virginia Turner. So we currently have those, 1-year unexpired, 2-year unexpired. I believe I indicated to the county commissioners that when we had some candidates at that point, I will go back to the county commissioners for those appointments. Okay. So, if there's anybody that is interested, and I think that what I would like to do, because we didn't have any applicants when we had advertised for it last time, I think I would like to repost that, not even necessarily in the newspaper, but just around. I don't know how many people really pay attention to the ones in the newspaper, but I think we can take that same ad and just tweak it a little bit, and I'd like to post it in the regular places that we put our agendas at the post office and everything, so we can get the word out and just get the word out.
Another good place to post stuff is in the exam rooms and
Oh, really?
like we have little bulletin boards and.
Okay.
Good idea.
Yeah, good idea.
And might even put it on the reader board.
Yeah. And, either to fill out a board application or a letter of intent is what the commissioners have asked for, so that they can review that prior to any recommendation that we present to them.
Yeah, one other thought too, we've got an election coming up. One of the people who expressed an interest in the past is presently running for sheriff, which is probably why we haven't heard from him. If he does not get that position, maybe he'll be back interested in the board.
He would still be interested.
Okay, all right, good, because that's another option, Rob Larson.
Actually, I talked to John Updike yesterday, and he's interested.
Oh, really?
Okay.
I'm also interested.
Great.
That was the whisper. The stage whisper, I should say.
The 1-year term.
I was trying to get you to
Give
do
it a
it
try.
this last time around.
I know.
You quite weren't ready, yeah.
I had a vacation to take first.
Yeah, I know, I understand. No, I think this is great, so, Jim, and
Just for the record, I did do the oath of office.
you did do the oath of office, okay,
So I'm legal.
very good, very good. So Jim was appointed to that 3-year term.
And I just saw a lady walking down the street as I was driving here, that I would call and ask her if she would be interested
Okay,
too, so,
very good.
yeah.
That's great. Okay, I'm excited. It's nice that, for a long time, sometimes it's just like, it's hard to find people that are willing to commit. I think we're in a good
It'd be nice to get
position.
people from St. Regis to the West End.
I think so too, and I was wondering maybe Robin from, was it Oasis, or
Oh, yeah.
maybe
Now,
someone
what
like
was
Robin would be interested on the West End. I know we had talked about that at one point, but,
Well,
because
This is the lady that showed up at the town hall, is that correct?
probably,
Robin owns the Oasis.
she owns it.
Oh, Robin owns,
Yeah.
there was another lady at that you and I talked to.
Oh, yeah. Anyway,
Wasn't her name Robin too?
no, Paula.
Paula.
The Robin, I think is interesting, but if you remember that when we had the clinic out there, she felt to be a conflict of interest,
That's right,
because she
Well,
did
not now,
express an
though.
interest.
right.
But that's no longer an issue.
Right.
Also, there was, they are not residents of Montana.
Oh.
We would have to
Oh, then,
look at whether that's okay or not.
that's not, well,
Right.
that's not okay, because they're district positions, they have to be residents.
They are a own property though, pay taxes in Montana.
I think
Kind of a fine line.
the requirement is, they have to be a registered voter, I think, which is what I read in
For
the
just the
state
district?
statute. What?
For just the district
District.
For the
position?
district positions. That's not true of the
Corporate.
corporate positions. So,
Yeah, makes sense.
so should we move forward on that, and?
Yep.
Any other comment? Very good, let's go into probably the most difficult discussion we have on the agenda. Is the proposed write-off of the health center debt. And I'm so glad that Bill's here today, and you look really stern. And the Cliff's better, so, I don't know if we just wanna pick up where we
Better
left
than
off
what?
and.
He was not well.
He was sick last
month.
month, and, we weren't able to do that. So, what is the situation where we are right now? Where are we right now?
Yeah, can I give you an update on kind of what happened basically in that period
Yes.
of time? Well, the $305,000, of course, was a figure that was come up with mostly through John Earl's efforts and,
Sure.
well, Cindy and Larry and myself. And there was quite a bit of, for lack of a better term, write-off already to come up with that $305,000.
Right. Yeah, cause it was upwards of 700 before, and then it was even
Yes.
higher than that before.
Well, yeah, but that 700 was,
There was some of that was prior to the actual QHC coming into existence.
yeah, and some of it didn't include any offset for FQHC paid people working in the ER at that point, is that correct?
Yeah.
Yes, it did.
Oh, it was, okay, that was after that was backed out,
That was
okay.
backed up. That was, this is the net figure after
Okay,
that.
so go ahead.
So, and then, in the period, so that was as of June 30th or May 31st, depending on which date you use in that memorandum. So between the period from the end of June till the end of December, there was actually another $66,000 applied to that amount, so that brought it down to $239. Bill has proposed that, there's like $36,000 apparently in credit card money sitting in the bank account that's essentially the clinic's money. It could be applied to that.
So how much, say that again, how
It's
much?
about 36,000. We were using the hospital's credit card system up until just recently in May. We now have our own credit card system, and about 36,000 that, I don't have the only reason I'd say about, because I don't have the exact figure for April and May and the short period of May yet, but that was going to the hospital bank accounts that we weren't having transferred over to us.
Okay,
And so that brings it down to around $203,000. But that's contingent on if the debt's forgiven or not, or however we do that.
Well, and there's one other big factor, I think, in there, and, I mean, Bill may have, I'm sure has a better number than I do on that as well, but the other thing that's in there is there was a whole bunch of disallowed expenses, that were billed to innovations and came back that have to be paid, and those were Steve Cardy and,
I thought that stuff was all taken care of. Was
No, it
that-
wasn't.
That wasn't?
no, it wasn't.
I did a very extensive investigation to prove that it never was taken back, and it was never paid back to the innovation grant, so our board has just approved for us, and luckily we came up, we have some cash right now that we're able to do it, which I was hoping to propose other things to do with it, but, we're gonna have to pay that $146,000 back to the innovation grant, and our board just approved doing so.
Or you're just,
Well, during that same period of time, the amount owed from the clinic to the hospital went up by $500,000. So,
but that's all
Can
in
we-
that seven
can
I
we
know,
break-
that's why I don't.
That's what I'm
is
trying,
that all
that's
part of
over
it?
and above the
Can
$700
we
figure.
break this down somewhere, or,
No.
I mean, I'm
Okay.
just, there's just numbers floating
So,
around in my head.
so
I
the
don't
only
know how
thing
they-
that's different in that from the numbers before is arguably the financing cost of borrowing it.
Well, yeah.
I mean, you can't
And
count it
that's what I'm
twice.
trying to
No.
understand.
Yeah, you can't count it twice. If
Well,
if the health center
The point
owns,
of me telling you about all that is that it wasn't the hospital, we're still out the money. We should be able to pay that back. It's not like we had cash and you said, oh, here you go. We still owe that money.
And
On
that
the
whole
operating.
$400,000 was for the health center?
Well,
No.
let's just say if
I get it.
if it wasn't there, we probably wouldn't borrow it, yeah.
but to the extent we're adjusting that
I guess,
$700 figure, I mean, for instance, the $147 that the health center is paying, let's just, and there's no way to
Oh, we
really
need to-
put a number to that, but if that was 50-50 hospital and health center, just say, then that 50% of that we're paying would go back towards that amount you borrowed.
True.
Sometimes a a whiteboard would have
Yeah.
been so much simpler.
Put it easier, yeah.
What's that,
You're
Mr.
right.
Ward called?
Yeah.
I got one of
What is
those too.
Trams, it's called trams.
There we go. I'll do it in red ink, I think that's
Smart
appropriate.
words upside down.
That is appropriate, ready.
I just wanna
All right,
see, I wanna
What
be
do you
able to
wanna
see clearly how all those numbers that Cliff was just saying fit together. I mean,
Do you want Cliff to walk back through?
well, maybe that, I just having a hard time visualizing what,
Well, first of all, the 305,000 is out
Okay.
there, and then subtract 66,000.
How do we label the 305,000?
That was
that
the
was the agreed upon amount.
That was agreed upon at
The
June
MOU.
30th.
That was the
Yeah.
MOU amount. And then
Okay.
you're gonna subtract 66,000 from that.
okay, the 66,000 was,
That was what was, that number,
that was
number as
paid,
of
that
June
was
30th.
paid back.
This was 630?
Yeah, that's 630. And then that
13.
amount, from then until 12/31, when the clinic went on their own, there was actually another 66,000 applied to that.
Okay,
So then you're down to 239.
Got it?
And then there's the potential another 36,000 to come off of it.
And what's the 36 on?
Credit card
What's the
pledge.
Credit card.
Credit card
Credit card.
leftover
July
CC.
1 to
Potential
the current
credit
date.
card payback.
Is the return of the Subaru in there anywhere, or does that have
No.
to be?
No,
that's
no, the clinic has taken the whole
It's
brunt
36.
of that, of the Subaru.
So that brings it down to
203.
203. All right, then it gets more complicated, right?
Well, I'm not sure it does, in a sense. If you take, what's half of 146,
73.
Say that 146 was 50-50, and we don't have a good picture on it.
Why do we owe anything for the 146?
Well,
Why
it
are
was-
we
Well,
involved?
everybody
Because
always.
Steve spent
It's
it.
the innovations grant.
Well,
No.
it was expenses that was disallowed and
that shouldn't have
expenses
been,
that either the
For
hospital.
the
or clinic-
innovations grant.
No,
No.
Steve and George spent it, and it wasn't for, they
It
tried to
wasn't the
charge.
I understand
100%
that.
Steve and George though.
Well, okay, but it was charged to the innovations grant, and it was inappropriate to charge it to the innovations grant, so it wasn't innovations grant. That's like, if we started charging
They spend over.
half of your salary to the innovations grant.
Got it,
They
okay.
said no.
Okay.
So,
so,
Yeah, I know it.
this was my question,
But we should recognize that.
yeah.
yeah,
Well, we're
so,
saying if we just said 50-50 was each, then if you said 73,000 of it belonged to the hospital, you would take that 73
I mean, cause some
off.
of it was, I mean, I know, one of those expenses, some of it had to do with like sponsoring the trail rail run, there was a bunch of just random things. But, that aside, when we had this discussion last month, my concern was, the collectability of it, I didn't know that there was this whole innovations thing. Secondly, if it is uncollectible, I wanted to know if we could negotiate even a portion, being able to collect a portion of that amount. And what is the health center
Well,
able to
it's
pay?
probably, I would say it's basically uncollectible today, but whether we'll have money in the future, I don't know. I mean, we're projecting at a break-even level for the next year.
And what the health center is able to pay is the 36, which is on there, which
Right now.
they've agreed to, and picking up all of the 146 without any claim back to the hospital. So, I mean, that's what the health center can do, and
We
one of
got
the
lucky
reasons.
and.
So you're willing to pay this amount?
146 back.
No. We are paying the whole 146.
Well,
On top of that, if you
Take
figured,
73 off.
if you, we're, okay, say half of it is hospital.
Pay back to the feds here.
Yep, pay
Right.
back to the Fed. We're paying all of that, not
To
expecting
HRSA,
anything
right,
from.
it's HRSA.
Yeah, is it HRSA?
It's not her, so.
It's a different granting
It's a
agency.
different federal grant.
Oh,
Don't think that
CMMI,
grant-
CMMI.
Yeah,
Yeah.
that's not through her, so.
Well, just feds.
And
Good enough.
we got down to the 203 by saying we were 100% not asking for any of that 36.
Right,
So,
right.
So you're in a position to pay the 146 back?
We are paying the 146 back to the feds. We ended up doing some good collections over the last, so I'm gonna have enough money to pay that back luckily.
Well,
So
that's the point.
Okay.
We've got enough money to pay that back right now.
That's the point, though. I mean, you have the 146 because we loaned you, we
Well-
cash flowed you for the previous year and a half.
Yeah, well, the reason you have the 146,000 now is because you collected accounts receivable.
Well,
during
some of it is
period
that
time.
accounts receivable in that
Carried.
305 true, some of it's the collection of that accounts receivable in that 305. I mean, we wrote off a lot of that, the accounts receivable was brought over from the old court because there was a lot of them sold, we couldn't collect it, we did collect some of that money.
That was included.
So
in
some
the
of that
205
is,
number.
some of that is in there, the ability to be able to pay that 146
That
back.
was the negotiated number for
Well,
everything.
whatever it was, that receivable figure was in that 305 when it was developed, so if you, as John says, if we're just talking first, if you took another 73 off that 203, you'd be down to 140. Say we split the 146 at half and half.
again, yes, part of that is recovering back those receivables, which is why we're willing to walk away from the 36, why we're willing to walk away and are capable of walking away from the 36, and why we're capable of picking up the whole
Yeah.
146. So, the
Right.
part, yes, we have that debt owed to us that we're now collecting because you bankrolled us, no doubt about it. And we're putting all of that into the pot. We're paying the whole 146, and we're walking away from the whole 36.
But we still owe the $400,000 equity line?
Yes.
Yeah, that's the point.
Oh, yeah.
Yeah.
Well, and here's our contribution back as best we can. We don't still, I mean,
So basically what you're saying to me right now is that you're gonna pay another 36,000 and that's it. Is that what-
and the
now, that's all we
146. And that's all we've got, and then we're down there.
Well, 140.
Yeah, but you're saying then the whole 146,000 is our responsibility.
No,
we're-
we're paying it.
We're
No,
paying
I know
the
you're paying it.
146.
You're paying it, but
You
you're
want
taking
the
off
credit
our-
off the 200,000 for the whole 146,000.
We're saying only knock 73,000
Percent
off,
half.
which would be half of the 146.
Yeah, maybe.
But not, you don't have to pay it to us, we're just saying knock it off of that receivable,
What's that leave, Bill?
140,
130.
130.
So that leaves you basically with 130, we're asking for forgiveness on, because we
So-
don't think we can collect it.
See, and that's where I don't know, because you should have that should be sticking out in your AR somewhere.
Well,
Well, let's-
it's not because the auditors wrote it off, but it's not, well, if we reestablish it,
Okay,
if we reestablish it, and as the auditors told us, if we had it on there, well, they told us on both sides of the books, they would've put an allowance in for it, for the
Yeah,
inability
they
to
didn't write
pay.
it off, they put in an allowance for it.
Right,
It's
so-
an
What is-
uncollectible or not.
I mean, if you want it on the books, what we're saying is, well, maybe somewhere down the future, we might have the money to pay it, but
What
I'm not,
does that
I don't
mean?
see that
We're speaking.
in the near
Yeah.
future.
Yeah.
They're spinning above my head.
The
Why
auditors
would you
look
pay
at an
off
account and they go,
146?
your
Why
chances
would
of
you pay the
collecting
whole
this are.
146?
We do that, or we lose that innovation grant, and we don't pay it back to them.
So how is that different
Yeah,
from
but
them
they
just
used
saying
it
this
to
is
go-
total, completely
Well,
uncollectible?
they didn't
Things
use
for the-
it, George and
Is there a
received it
difference?
for stuff that they
Get it.
shouldn't have charged
Yeah.
to the innovation grant.
Right, stuff for the new hospital they were gonna
A
do.
lot of it, yeah,
Yeah.
They were
trips to, for
considering
the
the
grants and
situation
stuff
we're
like
in
that,
with the next gen
that wasn't part of,
So that should be
Very
owned by the
aggressive
hospital
on
now.
well, but we're saying, we don't, a lot of it, we can't tell how much it would, could have been, who belonged to who, so
The fact
we're
that
saying,
he now has
we'll concede half of it. You know,
tells me that
I agree, I think more of it goes to the hospital than the clinic, but
Yeah, we did.
we're willing to
That's why we're
concede.
Nice
saying
box.
We wanna get this over with, we're willing to concede.
responsible for what on that $146 bill, that's why we're walking.
Kind of scratch around.
No, we're paying the whole thing.
I know you're wanting credit, but you're still wanting.
You know,
Well, yeah, but you're asking for credit twice.
Lloyd,
If you.
go ahead, Lloyd.
If we-
I don't have anything to say on it, other than we've got a lot of little private meetings going on over this subject, and we're wasting meeting time.
I would like to say that it's just difficult for us to look at this the same way the health center does, when we're barely meeting payroll every day and barely meeting our payables obligations. I mean, we are really, really struggling to do that. I mean, you know, whatever is best for the system, certainly we will do.
Is the health center paying like $5,000 a month for rent?
Not right now, but we're supposed, in fact, the meeting I gotta have with, me and Cliff talked about this morning, me and Larry and we have to do a meeting about, it's supposed to resume June the 1st. We're supposed to renegotiate June the 1st, and so we need to have a meeting to talk about that and present something to the boards. But, we're paying all the other bills like malpractice and housekeeping and any drug costs.
You're not
Stacy
paying malpractice.
Stacy bills us monthly for all those, and we've paid all of those.
Are they now?
We've paid all those for this full, yeah, we're still not on that federal malpractice program yet, we're just.
Oh, that's right, you
We're
were
putting an
reimbursed. I'm sorry,
application
you're-
in
that's
right now to do that. So we're paying all the monthly bills right now. Stacy bills us on a monthly basis for all of that. We're paying it all. We're all paid up to date for this fiscal year.
And you're looking at Partnership Health as a possibility of increasing clinic revenue?
Well, we're looking at Partnership Health as a possibility of having a relationship, because one of the problems with the clinic was, with our grant, when it was received, these gigantic
Bill.
performance.
We are looking at them for two different purposes, one for management, and the second would be if we wanna go with them for a partnership to be able to get our numbers for the grant.
Well, and there's some other factors in there too,
So
for
it's-
instance.
Right now, we're still just, we have the
Talking.
CEO
Yeah.
as our CEO on a temporary basis. That's where we're at right
Yeah, it keeps our management costs way down. Another factor is that there are about, and we don't know real good numbers because of it was pulled out using zip codes before the realization that some people with an Alberton zip code actually live in Missoula County. But there are roughly 200 people with Mineral County zip codes that are going to Partnership in Missoula right now. And there is hopefully the ability with that relationship to steer some of them back here. The other thing, there are other services that the health center is supposed to provide as part of the way the grants work, and that Partnership can be very helpful to us in being able to provide them. For instance, mobile dental clinics and things like that, you know, another thing we're looking at is, we've heard a couple rumblings from Dr. Pafford that he was getting a little burned out and that he can't get any vacation time, et cetera. Having a larger organization.
Laurel too. with
Well,
the
yeah, and
vacation.
having a larger organization there that has more people that can send somebody up for a week while Dr. Pafford goes away and things like that are another advantage to being able to partner up with somebody bigger. So we think there's a lot of pluses.
Yeah, and at the last board meeting we had, you know, I threw up something there, kind of fell, it's in the minutes, but I'm thinking about creative financing. We have
That's what I'm
someone
wondering.
that's an accountant here. And if there's anticipated increased health center revenue, and you're paying already $5,000 a month for rent.
Well, they're not.
Well, there will be, right?
Some amount, we gotta
Okay.
negotiate that, but some amount.
Okay, because in the minutes there, I saw $5,000,
Well, they were.
That's what we were paying.
okay. Well, the creative part of it is what I'm thinking is, if we forgave whatever the balance is, that comes out to 140,000 or whatever it is, if there was some kind of a rent increase based upon your volume increase to the point where that 140,000 is paid off. And then you win because we forgive and it'll take us some time to get the money back. But,
And that, I understand what you're saying, it's not an uncommon relationship in a commercial, retail setting where the retailer pays a base rent plus a percentage of revenue. The other thing that complicates that a little bit,
I don't know what you're, but if we're able to go this thing of us buying this clinic building, there will be no rent.
Makes it
Right.
all moot.
then there won't be any
You'll
rent.
own it.
Although, the other side of that is that we can take all of this into consideration again when we negotiate the price on the building.
Good.
But that doesn't help them if they can't make payroll. That's a long term.
Yeah, well, and we don't have a short-term help for them.
No.
I mean, the pile of cash we've got at all from collecting some of those receivables, we need to pay the 146 with, and we need to get that done.
So Bill, do you
That's
know
true.
what your AR is at this point? I mean, is there still a
Our
lot of
AR is
old
about,
AR out there, or have you collected, I mean, are your,
well, we
is your AR
collect a
days-
lot of the back AR as part of us building up that cash to be able to do this, but our AR sets at about, $398 right now, but about 198 of that is over 181 days, and so a lot of it is not what we think that we will ultimately collect. Plus we're going back, and we're going back in a lot of our AR and qualifying people for sliding scale, which will, and remember, when we see new patients, if they're on sliding scale, that drops them out, they owe us sometimes down to $10 if they
Right,
have
but
a
that's your
low enough
grant,
income.
that's your grant money that you're getting.
Well, and we have to
Right.
get those sliding scale to keep getting that grant money, so
Yeah.
that comes in, we're already getting the grant money, we have to drop that AR down, but, so we're reducing a lot of that AR based on qualifying people for sliding scale that we're back in the past several months.
Yeah, and another function of that is if they come in and look at what we've given in sliding scale, and we've given out $300,000 in sliding scale over the year, and they've given us $600,000 in grant money, they're gonna reduce our grant money.
Exactly.
So that's why we've
you know,
gotta,
we've gotta make sure we apply that.
we're diligently trying to reduce that AR by putting more people on sliding scale, so we help satisfy our grant requirements.
If we don't do that, we're not, and we can't count on next year having as much grant money
Right,
because of that.
right. How
which-
much of that 398,000 you say is about what your AR is?
Right,
Is 50% of that over 180 days?
50%, yeah,
50%
right
over
at
180
50%.
days? And what's your case mix on that? Is it mostly self-pay at this point?
It's, what's left in that's mostly self-pay, cause anything Medicare, Medicaid, insurance is already paid.
Okay,
Of
so it's not
anything.
insurance money that's sitting out there,
No,
it's private pay.
we've worked all of that to an extensive and collect the most
So
of what we're gonna collect on
You have about
Medicare, insurance.
100,000 in insurance money then is what you're telling us,
Well,
that's
if
out
that's
there.
all self-paid.
You mean
180 days, then.
What's not in that 180 days, yes, huh?
If you've got 108, everything over 180 days is self-paid, who's trying to collect that, because I know you're not using a collection agency.
Well, we're working on it through our own staff, trying to collect it right
A
now.
lot of that's gonna be,
And we're, and
No
we,
pay.
as I
Yeah.
said, a lot of
Yeah,
it's
it
gonna
won't
be
be
written
paid.
off through
Self-pay,
sliding,
no pay.
through the sliding scale fees, so we're going back to that old stuff and getting with, and contacting patients, and if they qualify for sliding scale, then we'll write it off based on sliding scale. We wanna work it really good before we can even think about turning anything over to a collections agency.
And if half of it's sliding scale and disappears, then you got half as much, by the time
Right,
you've
no,
done
I understand how that works.
sliding scale stuff.
All this numbers on the board is great, I'm just glad you asked for that. But the elephant in the room is the $400,000 equity line to me.
Yeah.
We're still, the hospital's still responsible to paying back that $400,000?
That 400,000 wasn't all for health, I mean, that was for our own, that was to cover our own expenses.
But wasn't a lot of it for the health?
Yeah, but if we hadn't had the expenses of the health center during that period of time, we probably wouldn't have borrowed that $400,000.
that is true, but the whole thing is a joint effort of both. And the decisions were to run both the hospital and the clinic, converting it over to the health center. Okay, so the line wasn't drawn at that time.
Well, this is only from the time the health center was in existence forward. No, I'm not talking any previous.
Yeah, the management was still the same, the accounting was the same, the
That's true.
operation was the same, and for all practical purposes, you had a double board that was the same thinking. Okay. And for drawing a line now and saying we versus they, it doesn't match.
I think that's a huge mistake.
The problem is that the clinic was going through their next gen conversion at that point in time, and they weren't collecting money. And so we loaned them money basically against their AR. And now when they're collecting the AR.
Well, the clinic was going through the next gen conversion before the health center, before the FQAC was ever formed. It started next gen before that
None
was
of
ever
the figures
formed.
I've said are before the FQHC was
So
in existence.
that's not completely, but,
And a lot of it is being paid back up there, getting down to 130. And again, yeah, the debt's there, but that debt, money or an entity that was created by that debt is what's leaving you the 36. Money or an entity that was created by that debt is what's picking up what is theoretically the hospital's half of that 146. And some of the other numbers that got you down to the 305 and the 66 were health center paid people working in the ER and things like that. So some of that 400,
The people
maybe,
working in the AR.
and
is
if you
already
wanna
out.
leave 130,000
yeah,
on the books.
yes.
That's fine, and I wish I could say I could write you a check today for 130,000. I would love to be able to do that, but I
We'd accept it.
can't do
Well,
it.
yeah, I think the problem with leaving it on the books, and the other part of that elephant in the room, is that if you leave it on the books, Partners doesn't wanna partner up under circumstances where there's the potential for them to have the liability for something on your books. And if we don't partner up with Partners, we don't get that use of their patient numbers to bring us closer to what was put in the HRSA grant when it was filled out. There's a much bigger chance we'll lose that grant, and that we will have to operate.
Yeah, I'm gonna say, we've heard that a couple of times.
I
so
understand that, but we're leaving that out of the discussion, and there are some people here who maybe weren't here the last time. The clinic will have to operate with, what is it, 65,000
The
a
clinic
month
won't be able to
less?
operate without that grant money.
Okay, then you're gonna get the clinic
Okay.
back, and you better do a budget for that before you say, hey, we're gonna hold them to it. Cause I don't think you're gonna come out
And
ahead.
if the hospital's already in
Not
financial
Okay,
shape,
wait.
now.
Jim,
We
let's,
can't use the patient numbers from Partners unless they come here.
Right?
unless we completely
Unless
partner
they
with
want
them,
it.
is the only way we can use
I
their
would,
patient
I
numbers.
would propose that we get, the critical mass of the right people together in this room, lock the door, and you gotta get it resolved before we open it. Cause we just keep banning
And yeah,
numbers back and forth, back and forth.
Well, I think we agree on the number.
and it feels like we've hit a wall.
Well, no,
Well, we haven't voted
The
yet.
elephant,
I know
the
we have
elephant
voted.
still is that $400,000 equity loan. That's not being addressed adequately, I don't think.
Well, where's it gonna come from?
Well, I didn't say where it's coming, I just said that's a problem, John,
Yeah, no, it is a problem, I agree.
and we ought to try to bring some resolution to it.
You know,
Well, I think we can talk behind closed doors on this.
no.
No.
One more point here, I mean, you know, with the health center, I mean, it's just a fact of life. I mean, what happened when the FQA, it wasn't being managed properly until January 1, you know, we all recognize that, but as of January 1, I mean, talking about costs and impacts, I mean, you know, the health center, when Cindy and I finally got it straightened out, I mean, in December there, effective 1st of June and some of it carrying on until the 1st of February, but we added almost $200,000 worth of expense, you know, in terms of medical providers during the day, because their rules prohibit, you know, the crossover there. I mean, that's not included anywhere in these numbers either. I mean, you know, it's just a fact of life, though, that.
But offsetting part of that, though, we collect the revenue for visits that the clinic used to collect.
Right.
So it's not.
But it's not a wash.
No,
Yeah,
it's not a
no,
wash.
it's
not at all.
It's not.
And
You don't collect much that comes out of it. You know, you do collect some, but you don't, a lot of it in the ER is uncollectible. I mean,
And that's, and you're absolutely right, you've added that expense, and that comes out of the structure that was set up and what goes along with the grant. And that's all an analysis and decision that should have happened before
Right.
the decision to
Right.
go FQHC.
you can't redo history, I mean.
Yeah, and it didn't happen, and we're where we are.
I wanted to throw up one piece,
Go ahead.
and that is the dental piece, and your consideration with Partnership Health, does that have any, bearing on Partnership Health?
well, we've
How we
already
serve our
used their
community?
mobile dental clinic once, and we're gonna continue to use that, and we're setting up things, which is part of our grant we have to do, we're setting up other possibilities for dental services. Is that what you
St.
were
Regis,
asking?
we hope.
And we're certainly gonna look at that.
Yeah.
So what's to prohibit some kind of a structured payment? I
Well,
mean,
right now, and like I said, our whole next year's budget is budgeted on absolutely a break-even situation for next year, so
But if dollars came above your budget,
if dollars came above the budget, yeah, we could talk about probably some payment to pay that $130,000 if the boards, both boards want to agree that that's the figure. But it would, you know, I can't at this time commit that it would be,
What prohibits the
$2,000
structured
a month?
payment is
Well-
that it's a debt, you're saying, partners, here's a payment you have to make.
but
okay, but I don't understand why why the partnership with partners has to be structured in such a way that they're assuming the financial risk.
well, if they.
Can't something
It
like that
doesn't,
be
it doesn't,
excluded?
because this is owed by the MRHC Corporation. They could assume, but if they assume all of our activities, they're gonna get all the revenue in. And we're not gonna have any, we wouldn't have any revenue to pay it back anyway. They're not gonna, so I can tell you, they're not gonna assume this debt. Whether it's 300,000 or 50,000, they're not gonna assume this debt. They're not going to do it.
you
Is
can
this-
carve it out.
So Bill,
Is this the only debt that the health center currently owes?
Yeah, other than regular bills, yeah.
Somebody, Deb,
So-
did you?
So if you partner with partnership, does that take the MRHC away? Is it now partnership?
It
Is that what
doesn't
you're
take the
saying?
corporation away. It doesn't take the corporation away, and we're gonna put things in place to keep the corporation there. And if something happened, that it could revert back to our corporation. But because it basically takes away, makes us completely a part of them, and it has to, in order for us to utilize their their
Be
numbers.
able to count their patients.
See, they have an excess number of patient numbers, and we have a deficiency because people way overstated what they thought we could do here.
Exactly, I
Yeah,
understand all
okay,
that.
so,
I
so
just-
in order for us to use their, it can't be just a management agreement. It has to be a full,
So
for
the
us
F-
to use their numbers, it has to be a full-fledged, complete affiliation.
So MHRC goes away. It
No.
becomes a
Corporation doesn't
partnership
go
now.
away.
Okay.
No.
We really become
Let me, here's my
we
vision.
really become a satellite to partners.
Or is it a
Well,
satellite? I
No,
don't think it's a
no, not
satellite.
really. Here's
If
my
they-
vision.
If they take all our money and count all our patients, I don't see where you're getting a satellite. We might get resources from them to provide services, but we're a satellite, plain and simple.
Well,
Here-
if you're a
but-
satellite, you
I
don't
don't
get an
think
extra
it's-
650.
It's not a satellite,
Yeah,
cause you don't
yeah.
get the
Now,
satellite.
here's my vision
Who's
of
gonna
how,
get the 650?
how it would work. I think one of the things that was more important as we talked about this, at the health center than anything else is not putting ourselves in a position where we turn things over to partners, they could later decide to withdraw service from Mineral County. We felt really strongly that we needed a handle to keep that from happening. This deal with the possibility of buying the clinic building came along and presented a really, I think, good mechanism for doing that. And that is that the Mineral Regional Health Center Board remains in existence. It remains the owner of the clinic building and the contents of the clinic building. Leases that to partnership for $1 a year, and partnership runs the whole show. And it's partnership doing service in Mineral County so their patients can be counted. If they suddenly decide, well, we don't think we wanna continue operating in Mineral County, Mineral Regional Health Center, the existing board that hasn't been running anything for a while, still owns the building and the stuff. So we can reopen, in a sense, our own clinic here under Mineral Regional Health Center. And that's just a very general broad brush. Partners hasn't agreed to anything like that yet, but,
Right, but if.
There is another
So we
option
have a
there.
grant application out there right now that we're waiting for a decision on.
right,
That is under the MRHC.
yes.
Partners obviously will have their grant application that will come under partners,
Which they've already got.
which they've received or whatever.
Right.
I don't know what their timing line is, but anyway, so.
You
so
did get
right now
approval
you
on the
have-
grant?
No,
No,
So right now you
they've got
have,
their approval on their grant.
Oh,
Partnership
in
does.
Missoula.
but we don't have our
correct.
approval yet, so.
But-
So right now you have two pots of money that are coming in, because they're two separate entities at this point.
Mhm.
So if that decision is made before you partner with partnership, you'll get the two pots of money. Once that happens, does one of those 650s go away because you're under
No,
partnership now?
It's all
The
one
person
fund.
has already agreed it would could be assigned over.
It could be assigned over, but can partnership really get two grants?
Yeah,
Yes.
person said
One
yes, they
still
can.
stays in Superior.
They'll be getting one for Mineral County and one for Missoula. They can get the grants will still be kept separate, but they will be, but it's kind of weird, the grants be kept separate, but we'll be able to utilize their numbers and number of patients.
Because that doesn't make sense to me, that
Well,
for a population, you have to have a
Hearst has
certain
been,
number.
this has all been discussed with Hearst already,
Okay.
they've acquiesced on it.
And Hearst, they have more than they
If you're
need for
using-
Missoula.
Right, but if you're using their population to
Yeah,
support our numbers, it
Well,
just,
it's because they have more than they need for
Well-
theirs, and some of what's their population is coming out of Mineral County.
I don't think that's necessarily relevant to what we're trying to.
Well,
yeah,
except
not
that
really.
Anyway,
there's money, which is relevant.
as far as this goes, personally, I don't have a problem with the payback, the 73. I don't have a problem with that, considering how muddled all that was, and a lot of that was, I don't personally have a problem with that. My concern is, are we, I mean, given the circumstances of the hospital, and we can say, well, if we say we forgive this debt, and say, well, oh, there's extra money, we'll pay you the extra money, that's really unenforceable. That's kind of, my take is I would like to have some kind of structured way to be able to recoup some of that cost.
Completely understand that, but if you say that, we're gonna structure it, we're gonna call it a debt, then it's guaranteed you won't get it back, cause we're gonna lose our grant. Then, unstructured, there's a potential to get it
well,
back,
then,
structure
if
it,
they're-
guaranteed.
Well, then when the health center is in the black, are they gonna bankroll the hospital because we're in the red?
Yeah, exactly.
Well, if it ended up in that situation, I certainly would vote yes for the plain and simple, just as much as we're serving as a hospital, or as the health center is providing essential services to the county, the hospital's providing essential services to the clinic, like the lab and the imaging and all of that, so I would wanna pass cash back and forth to keep things alive, 'cause
I can't imagine HRSA would allow that.
Well, HRSA would not allow us to use grant funds to do it. We would have to support it's being done by everything outside of grant funds, for sure.
Yeah, the grant funds have to be used for the sliding scale.
Right.
But that's not the only revenue that comes
You know,
into
you
the
got
town.
your program income, you can utilize that for.
Right,
Yeah.
for whatever we want, but the grant funds we can't, so we just have to prove. we're
I
not
really
using-
wanna be able to get this negotiated, I really wanna be able to get this worked out.
We do have to make a decision today, our audit is still open and it has to be closed.
Well, what's the bottom line, Cliff, as far as, how significant of a hurt does it put on the hospital if they have to, how much is the hospital actually going to be put out, and is that going to affect our payroll and our ongoing business?
It is right now.
It is right now, and it will make it worse?
The other thing that we haven't talked about right now, and I wanna make it clear that I always am for the facility as a whole, and I know I don't sound like it today, this is the first time ever, and I don't like it, but the biggest thing that's hurting us right now is 400 visits a month in the clinic. That is
And
the
we're
lowest number I
working
think I've ever
everything we
seen.
can do to build those visits up, but
And if we were doing 500 or 600 visits, then I would be a whole lot easier with.
And
So we
actually,
have
our
to
part,
do it,
our
but my responsibility is cash flow for the hospital.
our
That's my
relationship with
job.
partnership is gonna be one thing to help us build those, because if they can shift these 200 patients they're seeing of Mineral County patients back over to us, then that means we're seeing 200 patients we're not seeing now that will shift services to the hospital. And tell,
Maybe.
That's what we need.
possibly, but that is
Do
the
what we
best,
can.
that is our best source to get our number of patients up.
I mean, we've been
because-
talking about those 200 patients for 2 or 3 months, and we haven't seen them back yet.
Well, and we're not partnered
Well,
with
no, we're
partnership
not.
yet either.
Well,
Let me ask this
Have
question.
they outright said they won't?
Let me ask this question, Bill. You got 146,000 to pay to the
Innovation.
innovations right now. Can you write us a check for 50,000?
No, I don't have the
How much could
money.
you write? How
I
much?
can't write you a check for anything today. Not today. I mean, after I pay that, I'm not gonna be able to write a check for anything today. No.
And understand there's some urgency to paying that back.
Yeah,
Uh,
that's
There
what we
is,
paid back.
because-
Oh, sure,
Gotta be paid
sure.
back now.
It's been
Yeah.
hanging out there for a while.
Yeah, I think
Well,
several
and
of us
they're
thought it had
starting-
already
and-
happened and are worried it's not, and the Inspector General's office is subpoenaing, well, they're subpoenaing investigation reports back when we hired investigators to look at what was going on, so,
Our check just to leave the door today.
yeah, we don't wanna be hanging on to that money.
Right.
I've been asked to speak to the board by several employees just to voice their concern about this. They are mad as hell that we're sacrificing. We've had employees be terminated. It's, from what I've heard from many, many employees, it just doesn't seem fair that the hospital is sacrifice, and it's not reciprocal, and when they heard
Well,
about.
it is, we reduced
the-
number of employees.
Well, I'm just saying, this
We
is,
reduced
I know,
benefits, we did a lot of things
I
to
know.
cut our costs to get us into a
I know.
break-even situation.
I know, but
And
I was just asked to bring the consensus.
She's just a messenger, Bill.
I know,
Yeah.
but I'm just explaining the,
Yeah.
both sides of it.
Well, and I agree, and that's what I expressed concern about before, is I think the message has to go back to the hospital employees that know this wasn't one-sided. I suspect on a percentage basis, the health center cut more employees than the hospital did, when you consider the providers that were reduced as well. The hospital made the decision not to contribute to the retirement fund. The health center employees no longer get health insurance, they just get a payment towards in their check. So
That may well change soon. We're looking at that too, we're gonna
Well,
have to do that too.
But, it hasn't been one-sided, and I think it's important that the message get out to hospital employees that it isn't one-sided. Because and I said it before, if we get this us versus them, that's gonna really kill us.
I agree right there. I mean, we've gotta work this out compatibly.
Yeah, hospital employee, health center employees need to be, making an extra effort, and I emphasized that at a meeting yesterday with the health center too. Need to be making an extra effort to, refer things to the hospital. We need to be pulling for each other all the way.
Well, I think the demonstration that, gee whiz, Bill and Kim and I certainly had an excellent, series of town hall meetings, and Cindy too, 3 different times we've done that, and we certainly do communicate and present ourselves to the community.
Oh, yeah.
And the community thinks we're all one anyway, I mean,
Yeah, no, they don't understand the difference.
No, they don't understand.
Actually, it's something I suggested yesterday at the health center meeting, I do just because I bumped, and it was interesting, it sort of came up in a different way here today. I bumped into Holly, picking up stuff to do a barbecue for the health center employees. I heard the comments in here about the barbecue for the hospital employees, and I had said something to Holly yesterday, maybe we ought to do a joint barbecue with the employees of
Would be
both
good.
entities and start, yeah, we have to be legally separate and financially separate, but maybe we shouldn't be so separate as people.
Well, I think we've actually kind of talked about that kind of stuff a little bit, but we're off track, sorry.
Yeah, we are, and I'm probably responsible for that, so I apologize.
And I didn't steer us back, so. Well, Tanya has been really quiet.
I don't know, I guess I feel like there's one part of this that we still haven't really answered, and maybe Cliff and others already kind of know the answer, but I'm still not sure what it would look like if we did lose the grant, and we all became one again. And what does that really look like, I guess, is my question.
Well, if the hospital is losing money right now, I can't imagine how they could take over the whole clinic without the grant and keep and not be losing a lot more money.
With the clinic
Because
with
we
400
can only
visits
break even with that grant money, so I don't know how you could do it.
the 400 visits a month is what's killing it.
And actually, well, it's not helping us either, and when we're doing everything through public comments to hopefully try to build up through, we're at the end of this month, we're hiring at least a part-time woman doctor, which we've had comments that some ladies wanna see a woman doctor. We hope that'll increase our visits somewhat.
I think that will.
So we're doing everything we can to build up. We want more than 400 visits for sure too. We've got the capacity for more than 400 visits, but we're doing everything we can to try to work on that, but it's taking time. Because the public has seen this as a bad situation for a long time, and it's taking time to get over that. We're just now getting some positive comments for people coming back that have left.
Well, and I think the other piece of that is part of where we are now is the fact that making the shift from 1 to 2 was pretty rocky, and not everything worked well in terms of getting bills out and everything else. The shift back isn't just gonna be like that, and there will be other down periods and losses, and there will be, the shift back will result in another whole change for the community to